Hopes for ending the pandemic are resting on vaccines that could get approval in just a matter of weeks now.
But public health experts caution that there are still many difficult hurdles to overcome before a vaccine can make a difference. CBS 2's Dr. Max Gomez explains.
The scientific effort to produce what will likely be several COVID vaccines has been remarkable. Now comes the less glamorous but still challenging work. Massive vaccine manufacturing, distribution of the shots and needed supplies, not to mention public acceptance. Public health systems have never faced the challenge of immunizing tens of millions of people in such a short time. Actually, billions, since the pandemic is truly global.
Distributing them to states around the country, those states creating the vaccination programs in place to identify the high-risk target populations to get those vaccines, to keep them at the appropriate temperatures, to complete the 2-dose series, to keep track of all the records of these vaccines.
Dr. Jason Schwartz and colleagues at the Yale School of Public Health have just published an analysis of these complex logistical challenges. While Operation Warp Speed in the U.S. has been working on those issues nationally, Dr. Schwartz says state and local levels are far behind in their preparations. Then there's the thorny issue of whether enough people will actually get any COVID vaccine to stop the virus spread.
So an educational program, a communications strategy nationwide to help resolve the questions and concerns that the public is reporting will be just as important as the scientific work that's been happening in recent months.
Similar and even more challenging efforts will have to be mounted globally because the coronavirus does not recognize national boundaries. And since the vaccine immunity is never 100%, foreign hotspots can still spread. Dr. Max Gomez, CBS 2 News.